My name is Philip McCracken. I was diagnosed with blood pressure, I think, in around the early to mid-90s. We had a nurse at work and I asked her to take my blood pressure, and she asked me to go to the doctor right away. Not tomorrow, today. And I went to the doctor and had very, very dangerously high levels of blood pressure.
My name is Mary Fleming, and I developed high blood pressure because I had twins, and I developed toxemia.
My name is Ito O'Connor and I'm married to Porrick, who's sitting here beside me. He did an insurance medical in 2002, which then showed up that he had high blood pressure.
My name is Eugene Mulcahy. I got hypertension when I was just before 40 and tried to control it every possible way, with the pharmaceutical way, relaxation way. Nothing worked for me.
My name is Gerard Carney. In terms of family history, we have a nasty history of cardiology problems. I suppose something waiting to happen.
My levels was over 200. I don't remember the exact figure, to be honest with you, but I know my doctor was very concerned.
The readings were still staying around 160, 170, over 90 was never going, bottom reading was never going below 90.
My pressure was an average of about 160, 110. I have peaked 180s to 120s, but if you wanted to average it for 6 months, that's where I'd be running it.
It was 220, 230, maybe over 140. I knew that it was high. I had taken every tablet I would imagine that was in the chemist, one way or another over the years, and none of them was ever working, none of them.
Some of them disagreed with me. I had different side effects from different tablets. We maybe tried them for a week or two, or a month or two or whatever. We had to change, and that's the type of procedure I was going through all the time.
I'd be fine for a while, but eventually my BP would start off incrementally to go out of step and remain out of step. I was reaching the point of running out of medication options.
You get into a pattern just of living with blood pressure, and you're living with the constant fear then of taking a stroke. And you always seem to be cautious about what you're doing, and then that's what your family would normally be thinking, which time is going to be a stroke? Is it this time? Is it tomorrow? Or when is it going to be?
I was very aware, especially towards the last decade. You know, I'm getting older and this is going higher. Something is going to happen, and I hope it's not what I'm thinking it is.
One feature of the whole thing was that my blood pressure was pretty volatile, ranging from quite high and then it would go quite low depending on the medication. So it was always a battle to balance it out. And that kind of fluctuation was physically tiring and wearing. I always felt that mentally I was fine, I'd be on top of it, but physically I was getting wrecked.
He did destroy my life for 8 years of my life. It totally, I was gone. I would maybe work 3 months out of the year. That's how I could get. If I could class it as a percentage, I was down to 20%.
When you have somebody in my position and you have a family depending on you, they're wondering what's going to happen, what's the future going to bring, what are we going to do, the what if. And there was always a question of me departing the world first, you know. And I kept telling people I was in no hurry to leave. But yeah, there was an underlying worry there all the time.
I used to eat healthy, right? And I used to make sure that I used to exercise a lot. But when the BP is high, I couldn't exercise. So it wrecked my health from that point of view, because I had weight on, weight off, weight on, weight off. And it was just constantly I was not maintaining the levels.
I had nothing to lose. I knew at this stage, you know, it was like a walking time bomb. And nothing was working. I thought, well, okay, I'll go ahead with it. And had it done. And it did work.
The procedure was very smooth, very little discomfort.
It's painless. Maybe a little sore, maybe in the groin for a little while, but that goes away very quickly. I was back to normal the next day. I'm feeling quite pleased because the blood pressure was coming down maybe not normal, but gradually it was coming down.
Yeah, so I'm glad I did it, and I have no regrets, and the procedure was very good. Pain-wise, I have no complaints and no side effects, and I feel good.
Well, to me, it's a life-changing experience to get it done. My advice to people would be take it, grab it with both hands if you can, to be taking your blood pressure and seeing it down at the levels that I'm presently at.
My last appointment with Dr. Sharif was here last November, and my blood pressure that day would be around 139/70. And that was some achievement.
For Pádraig, it was a very slow decrease, and as it stands at the moment, all his readings are hitting below the 140/90, just below that, which we're very happy with, and Dr. Sharif is very happy with as well.
Yeah,
So biggest for us is, of course, that the risks are so reduced. He has told him that his risks now of having a stroke are much the same as the normal person walking the street with normal blood pressure, so that's the biggest relief for us.
What I did notice within, say, a week of the procedure was that physically I felt very, very relaxed and calm in myself for the first time ever, and that has lasted ever since. They don't worry about me as much anymore at home, now that things have levelled out, so that's a benefit for them, a benefit for me.
Now I'm running at like 135/85 average, which is fantastic. And I've been doing that since November. There's a calming sensation in my mind. I've never experienced a feeling like that. It makes me, I suppose, deal with life pressure easier, which is obviously having an effect on my blood pressure, because it is lowering it.
And it's made kind of the whole dynamic of family a lot easier. Before, he might be lying on the couch, won't be able to get up, whereas now it's a case of, well, we're kind of doing things together, we're watching movies together, we're going to the cinema, or we're going out for a walk, or whatever it is.
I'm so relieved that now I can delete from the back of my mind that I will not get a stroke, and that I can be human like everybody else, and I'm not going to end up in a wheelchair or to be cared for by people, that I'll be quite independent.